Texas is the biggest battleground state.
And in 2020,
we have the opportunity
to turn our state blue
up and down the ballot.
We have the opportunity to expand access to affordable health care, finance our public schools, strengthen our economy, and take meaningful action on gun violence. There's so much more in the United States Senate.
We have the opportunity to pave the way towards a more sustainable future at the Texas Railroad Commission.
We have the opportunity
to elect judges
and the justices
who will restore fairness, equality, and balance in our courts.
We have the opportunity
to shape the political future of Texas
and repair the broken systems
that disenfranchise working families in our great state.
We have the opportunity to ensure that Texans in positions of power
embrace empathy,
open minds,
and swing open the doors of possibility.
By working together
and uniting behind our shared vision of a more inclusive world,
we will win back our state.
We will win because we have to.
We have to put an end to the hate, the lack of access, and the suffering.
We have to deliver on the fair shot that every Texan deserves.
Our cause,
our movement,
is about the restoration of justice and the expansion of opportunity.
None of this can be accomplished unless we work together.
In order to bring lasting change to Texas,
we must work alongside every down ballot candidate, every activist, and every Texas Democrat
to continue building the largest democratic movement our state has ever seen.
We're asking you to be a part of this historic fight.
Together, we will create a Texas that we can all believe and thrive in.
Together, we will save Texas and in turn, save the entire country.
Join us.
Join us.
President caught red-handed lying about coronavirus, publicly saying
children are almost immune,
secretly saying the truth.
This is deadly stuff. It's not just old, plenty of young people.
Millions of jobs lost and 190,000 Americans dead. You took an oath to protect our citizens. Mr. President, these deaths are on your hands. It's time to put America back in the hands of a president who will protect the country and tell us the truth.
I'm Joe Biden, and I approve this message.
200,000 Americans have lost their lives to COVID. No community has been more affected by COVID-19 than the Latino community. We are seeing this impact in South Texas, in Laredo, in Nueces County, and in the Rio Grande Valley. Today, a few of our speakers who represent families all across our community are going to talk to you about what they are hearing, what they are seeing, and how our families are impacted by COVID-19 and President Trump's lack of leadership on this topic. First, we'll start with my very own hometown Congressman, Henry Cuellar.
Thank you so much, Rebecca, and thanks to everybody that's on the line with us, the judge, the congressman, Mike Silva, and of course, all of y'all. Look, it's very simple. We're facing something that we have not seen in 100 years. It's affected us in two ways. One, the health of the individual, and two, the health of the economy. Trying to find the balance means that we have to find people that can work together to get to find the solutions to the problems we're facing right now with COVID-19. The areas that I represent, or South Texas or Nueces County, all the areas that we all represent are being hit very, very, very hard. For example, in Congress, we passed a CARES Act. We sent a lot of money. Some monies went to the cities directly. Some went to the state. The problem is that the monies that have gone to the state of Texas has stayed with over $7.5 billion and counting. That money could have gone to the schools. That money could have gone to the firefighters, to the cities, to the counties. But unfortunately, the state of Texas has stayed with over $7.5 billion. I think by the end of the year, by December 31st, they probably will be closer to somewhere between $9 to $10 billion. And look, and I've been at the state legislature. I know what they're doing. They want to keep that so they can fill in the gaps for the next session that starts in January. But the problem is, Rebecca, you said, we need the money right now. And this is why having somebody like President Biden, he will tell the state of Texas, hey, this money is not to be hoarded or to be put in a piggy bank. We need the money right now. And I'll give you one last example, what happened there. We put $1.2 billion to the state of Texas so they can send out to the school districts. Well, as we worked on CARES Act, we didn't put that the money was to supplement. So therefore, the state of Texas, and I asked the commissioner this, are you supplementing or supplanting using that $1.2 billion? He said, Congressman, you didn't tell us we could not supplant. So we're supplanting, which means that they stayed with the $1.2 billion. And instead of sending that money and supplementing the school districts, they put that money in a piggy bank. And therefore, this is why we need somebody like Joe Biden that is able to sit down, work together, get the job done. And if somebody is hoarding money like they're doing in the state of Texas, tell the state, hey, put that money because people need it in South Texas right now.
Thank you very much, Congressman. Thank you for representing Laredo so well. Judge Canales, how have you seen COVID impact your community?
Well, I've seen it impacted in really a very devastating way. As Congressman Cuellar correctly described, the triangle that is South Texas between Laredo, Corpus Christi, and the Valley all the way to Brownsville was and has been the epicenter of the worst cases in Texas, the fastest growing, the ones that we can't seem to, quite frankly, figure out a solution to. Our county, Nueces, for instance, was at one point the best county per capita for cases early in the pandemic in March, April, and May, and quickly became the worst county in the country in the months of June and July after Memorial Day. And so I have seen this roller coaster cyclical event. We are now doing better again, but everything is dependent upon our population's, quite frankly, ability to access care. And so what I want to say is that 7 deaths, each of which, I have to be honest with you, affect me personally. Because these are my neighbors and my friends, and they've even been my employees. This is the ugly truth of what happens when an insured population is lacking sufficient insurance. We have a overall disproportionate rate in Nueces County of uninsured. We have a disproportionate rate of chronic health conditions throughout South Texas, but particularly in our county. And all of this is coming to be revealed in a very frightening way. This is what we in the business know is the social determinants of poverty often. And coupling that with just really struggling early on, the entire nation struggling. We were not unique here in Texas. Everybody was struggling with testing supplies and finding the right kind of materials to bring in to Nueces. We were one of 10 biological labs in the state, and we were having problems keeping up with the resources that we need. So when I ask our health department, how have Latinos been disproportionately affected? It's to the tune of over 90%. So even though the national statistics are terrible, within my own county, it seems that the overwhelming majority of deaths, almost doubling the ratio of Latinos nationally, are being disproportionately affected here. That's painful. It's a painful realization. I am the emergency manager for the county. I sit with my other 253 judges in the state of Texas doing the same thing. Just for the record, I believe in the structure that we have. I think it's a very good structure. We call it incident command. I work with my municipalities very well, and I even work very well with the organization that TDM has created. The problem is our Latino population does not have that access to health care like other populations. And I firmly believe, and I had to, take my lunch early so that I could be on this call. I left the courthouse because I am so committed to making certain that more Latinos have access to healthcare. This is why I'm on this call. This is why it's so important to me. I believe in ruling and working with it from the middle and working with everybody, but that's not what's happening. We're the ones that are dying in a disproportionate way.
Thank you, Judge Canales. We are, in fact, dying in a disproportionate way. It is affecting Latinos more than anyone else. And we have with us today Mike Silva from the Mission Firefighters Association, who can talk to us about what he's seeing as a first responder. Mike.
Hi, thank you. Give me the time to be here today with you all. Today, I'm here as a firefighter in the Rio Grande Valley to share my experiences during this COVID-19 pandemic. I see the devastation every day. This virus has caused our community great harm, as firefighters and EMS workers are usually the first ones to come to respond for the need for help. When someone is making a desperate attempt and reaching our government services for help, we are the public servants answering the call. And we want to protect our residents at all times. And these threats are tremendously one of those things that we cannot ever want the public to see what we see. But I have never seen anything as bad as what we're seeing today. And while people are looking at the president and the governor for help, they're silent and actively downplaying like this is nothing and it wouldn't hurt the public. The reality is this: it did not have to be this way. We all know that someone who has contracted COVID, or worse, someone has died from it. A lot of our firefighters have family members who have already passed away. We have other Brotherhood firefighters from other cities in the Rio Grande Valley that have passed away, have known someone who has passed away, and it doesn't have to be that way. Joe Biden stands firmly committed to helping the Latino community overcome the tragedies of COVID-19, whether it be affordable access to healthcare or to business assistance to our Latino business owners. Every 4 years, we say this is the most important election in our history, but here's what it really means. It's true. Millions of lives and livelihoods are on the ballot this November. And so the character of this country, which is why we need to elect Joe Biden, no doubt. He's the person that we need in office, and Trump has neglected every Latino, especially here in the Rio Grande Valley. This month, let us reflect on the countless ways that we as Hispanics can contribute to Texas. Let us reaffirm our commitment to expecting opportunity and building a higher and brighter future by electing Joe Biden. Thank you for giving me the time to be here and speaking with you all. It means a lot as a first responder to give our point of view of what we're seeing on the front lines.
Thank you, Mike. You just said something that's so important. We have gone, especially in South Texas, from knowing someone who has contracted COVID-19 to knowing someone who has passed away from COVID-19. That is a tragedy. That is a loved one that our families will never get back. And thank you for speaking with us today. Congressman Gonzalez, thank you for being with us today. Thank you for doing a great job representing South Texas. How have you seen COVID-19 impact the congressional district?
Thank you, and I want to thank everyone for being on this important call. Well, clearly, I've been very vocal about how my district's been impacted, especially the southern portion of it. And we've died at almost 2.5 times the rate as the rest of the state. I personally believe we had a medical collapse during July at that very high peak when we on one day lost 49 people. And we've continuously lost in the 30s. Our numbers are down, but still not dramatically. I've figured that something happened when there was a line of ambulances outside of a hospital waiting to admit their patient that they had behind, and these ambulances turned into virtual hospital rooms because there was no space in the hospital. And if you were in the hospital, they were lacking resources, many resources, medications, personnel, but even oxygen. In one hospital, for example, in the Valley, where a patient needed 5 liters of oxygen, they were only able to give them 2 to 3 because of the shortage and because vendors, regional vendors, were not able to supply the demand for hospitals in the southern part of my district, which was tragic. It was almost like something that you would expect in Cuba or some third world country. So I think that we need to continue to address healthcare, but also the demand of needs that we have during a pandemic or during an emergency to assure it doesn't happen again. And I've still not heard one hospital or hospital administrator or even a political leader use the word medical collapse. But if you can't get your patients into an emergency room to be cared for, and you have a shortage of ambulances to go out to homes because someone else had a heart attack, there's clearly a collapse in the system and a shortage of resources. And I don't think that still to this day, that issue has been addressed. And clearly our governor have failed us, our president failed us, and a lot of regional people in different parts of the country have failed us. But we've had a lot of failures here locally, and we need to look at ourselves in the mirror and have an honest conversation with ourselves to be able to tell our leaders that they failed us and where and how they did it. And having said that, obviously, clearly, I think President Biden is our only path forward, and our president has failed us. I don't think there's much dispute in that. And it's something I want to share with the Biden campaign, since I'm going through a campaign. I've polled this issue, and interestingly enough, people in my district hold, and this is important for the Biden campaign to know, hold Governor Abbott almost 8 points more responsible than President Trump. And I think that's clearly a messaging issue. I'm not saying Governor Abbott is not responsible. Clearly, he failed our district. I wrote an op-ed about that. I was very vocal. I got beat up by it by some people within my own party for doing it, but I still stand behind it. Governor Abbott failed Texas. He failed our area. He didn't have us wear masks for, I think it was over 4 months before he started mandating masks, something as simple as that the WHO and CDC had been recommending for 6, 7 months, 8 months before that. They lacked on resources. I think if a hospital can't provide the simple oxygen to a patient because there's a shortage, that calls for an emergency action from the president and the governor. So they both failed us. I think it's important that the people of Texas have that message. And I was kind of surprised to see that in my district, at least, the president would get a pass over the governor by almost 9 points, 8 solid points. And it's quite concerning. And it tells us, and I think it tells the campaign that there's an issue on messaging. Clearly, our governor should be held responsible for the failures in our state, but that came from following leadership at the national level, and that all falls on President Trump. And I think we need to continue to tell the American people and people in our individual districts of that failure and make sure that they recognize it, that they're cognizant, and when they go out and vote in November, they remember it. Thank you very much.
Thank you, Congressman. What we know is that Donald Trump didn't have a plan to address COVID-19 when he first heard about this 8 months ago, and he still doesn't have a plan now. Vice President Biden has a plan. It includes increasing PPE, increasing testing, focusing on vaccines, mandating masks, ensuring people have access to healthcare. Judge Canales, you talked about this. We are hearing the statistics, we're hearing the numbers, we're hearing stories about our families dying. Can you share the story of a person or a family in your district who was even more affected by a lack of access to healthcare?
Sure. I will tell you that I have had the privilege of really getting to know a lot of heroes during this COVID-19 response. I can think of one in particular that really comes to mind, and that's because we were really told, and I don't mind being a self-starter. I think it's important when you're a leader at the local level to help solve your problems, right? And so we tried to analyze quickly what a big problem was. And that is that so many of our community, our Latino community, did not have a primary care physician, a PCP. And so we needed to associate ourselves with Amistad, which is a local clinic, but it is a federally qualified health center. And Dr. Phillips there helped the county associate themselves in such a way that we produced a COVID clinic. And this man did not have a primary care physician, and he had a young daughter at home, and he had been hospitalized, but he checked himself out of the hospital because there was nobody home for his child. And yet when he went home, there was nobody there to help him get through the effects of COVID-19. So we were able to work with this clinic to be able to allow him to be a father again in order so that he could just basically get, basic health care. We take it for granted that people have doctors. We even take it for granted that people with doctors have the expertise to work in COVID-19 in this type of critical care environment. I can tell you stories upon stories of mothers who have children. Nueces County at one point, like so many counties, are now recognizing that our children might be asymptomatic, but they still are carriers of COVID-19. I'm sad to tell you that yesterday, a final autopsy report revealed that we did have a baby die of COVID-19. These are heartbreaking stories for our community. And they use the emergency rooms as their front lines because this is what we do when we don't have access to primary care. And so I will tell you that their names are vast. Their stories are all the same. They are mothers and fathers with children. They are not all old, despite what we think. But our abuelitos and abuelitas need to be taken care of as well. We have had major outbreaks in Nueces County, Rebecca, at our Corpus Christi State Living Center, in our detention centers. We have in some of our nursing homes. And I'm very proud of the fact that we've been able to work with firefighters in our own community who were asked to test every single person in every single nursing home and living assisted center. But what it revealed to us is the impact that the outside world had when you have community spread. And in the months of June and July, we had massive community spread. There was no ability to contact trace. There was no ability to find out how we were going to isolate you because it was everywhere. People would ask me, well, which zip code? Which zip code? And it was everywhere. But when I really drill down on the zip codes, they're the zip codes that are the high concentration of poor Latinos. And so their names, Rebecca, are their private business. but they are us, Rebecca. That's who they are. They are us. And there is absolutely no doubt in my mind that through the acts of heroism and innovation, we, the county, put forward a mobile testing. No one did that for us. We did that. Nobody put forward the COVID clinic or an alternate care site. We did that. And I'm proud of those things. But I also think that Vice President Biden is the type of person, because of the plans that he has put forth and been a part of with the Affordable Health Care Act, he understands that you should not be condemned to die because you have diabetes, because you have hypertension, because you did not have access to prenatal care, and because your children do not have a pediatrician. These are the elements that I see every day in my county. We are ground zero in the defense of the COVID-19 response. I'm okay with that, but it's nice to have a little help from our friends. And I think that our federal partners need to be a part of this. And that's where a national plan comes into play. Our state is only as strong as that which is the layer above us.
Thank you, Judge. Quick reminder to the press to please send your questions in the chat. Si los miembros de la prensa tienen una pregunta, por favor hágalo ahorita en el chat y en unos momentos lo contestamos. We know that there is no path to the White House without the Latino vote. This campaign in Texas is run by Latinas. We've got a Latina state director, a Latina deputy state director, a Latina organizing director, Latina supervisors, organizers across the state and in every community. At the same time, we know that Donald Trump started his first campaign attacking our community, and we have seen those attacks increase by his policies like ignoring our community on COVID-19. Congressman Cuellar, why is it so important for Latinos to participate and vote this year and vote to support Joe Biden and Kamala Harris? You're on mute, Congressman.
All right. It's important for Latinos to vote because who we elect as president is going to have an impact on their daily lives. Look, the state of Texas has been changing. The last time we had a census, and we got to make sure we do this census right, but the last census 10 years ago, Texas grew by 4.3 million individuals. 65% of them were Hispanics. You add Blacks and other minorities, 90% of the growth we had the last census were minorities. So the face of the state of Texas is growing. But when you look at the voting, we have to make sure that Latinos and Hispanics go out to vote because it has an impact. Let me give you a couple of reasons why. It's all a matter of choice. That is what you want to decide who that leader is. Look, 10 years ago, I voted for the Obamacare, the Affordable Health Care. We lost the House. We lost a lot of the blue dogs, Democrats, because we took that vote. In fact, my vote brought me one of the closest races I had 10 years ago because of the Obamacare, but it was the right thing to do. It helped a lot of Hispanics. But there's two things that are happening to the healthcare right now. As an example, one, we have a President Trump right now, who has been, they've been filing with the Department of Justice lawsuits to make sure that we repeal Obamacare. So in the middle of this pandemic, he's still pushing to repeal the Affordable Health Care. That's wrong. The other thing that we've seen here in Texas also, Texas is, I believe, 1 out of 17 states that has not accepted federal Medicaid expansion. What does that mean? That means that we could still cover another 1.6 million individuals. As you know, Texas has the largest uninsured number of kids. It also means that for the next decade, Texas will be leaving on the table over $114 billion that could be used for Medicaid. So if we would have expanded Medicare, if we would have not had a president that we've been attacking and trying to repeal the Affordable Health Care, which includes the pre-existing conditions, then we would have had a lot more people that would have had Medicare or affordable health care to make sure that we fight this pandemic. So Does it matter for Latinos who the president is? Of course it does. And we got to make sure that Latinos understand that this vote is going to have an impact on your life, especially on healthcare. And I just mentioned the Medicaid expansion that we just haven't taken advantage of here in the state of Texas.
Thank you, Congressman. I'm gonna, before I throw it over to Obi to pull some of the questions from the press, I'd like Michael to tell people watching, why does this matter? So why is this so important to you? Why there are so many people who've never cared about politics before, but there's so much at stake. Why would you say you've got to pay attention this year?
Well, first of all, it's if you haven't heard, the International Association of Firefighters were one of the labor organizations that endorsed Joe Biden. He's always been a friend, has always been a true friend to firefighters. And we know what it takes to have a leader like Joe Biden in office. And for firefighters, it's so important because we have so many issues on the table, and those issues are collective bargaining rights. We need to make sure we have the Safer Act grants that even Henry Cuellar has supported. The Safer Act, the Fire Act grants, those are all federal funding that we need here in the Valley. Without those grants, we're unable to have any success. And we know that Donald Trump is an individual who would see nothing more than to destroy labor, that he would love to see organizations not help anybody out. He's in it for himself, and it's so important that we get involved, that we interact with other labor organizations as well, to make sure that we get everybody boots on the ground to make sure that Joe Biden is our president. Firefighters need him in office. Firefighters know that he's our friend. And we know that with Joe Biden, he will get us the things that we need for the first responders, for police officers, EMS workers, firefighters, everybody on the ground that we need to protect our community. We need that equipment. We need the manpower. We need all those things in order to serve our community, in especially pandemics that we're in right now, something that we've never encountered. And so it's very important that we get everybody involved and make sure that we elect Joe Biden for those particular reasons. Without him, we're doomed.
Thank you, Mike. And Obi's gonna open it up now to read a few questions we've gotten from the press.
Hey guys, thank you guys all for joining us. I see that there are a lot of questions here. We're going to get to as many of these as possible, but unfortunately there's going to be time constraints here. So with that being said, if you have a question, indicate whether you want the answer in English or Spanish. So we can do both of those for whatever question you might have. So the first question is for Congressman Cuellar and Congressman Gonzalez. There are about 20% of undocumented immigrants in the RGV and in South Texas. How much money would be lost if they do not do the 2020 census correctly because of Donald Trump and because of the restrictions he's had on the census?
You know, 10 years ago, when I voted for the Obamacare, people were saying, read the Constitution, read the Constitution. Well, I'll remind folks to read the Constitution, because the Constitution says that when you do the census, you count all people. It doesn't say you count people with land. It doesn't say only count people that are white, people that can read. You know, all the barriers that have been put there in the past to prevent people from voting. The Constitution is very clear. It says that we have to make sure that we count all people, number one. Number two, we also have to keep in mind that if you get funding, there's different ways. I sit on the Appropriations Committee, and there's basically 3 ways of getting money down to a district. One, congressionally directed things that you can do in the appropriations. 2, that's number 1. Number 2, you can do grants. But most of the monies that go down to the communities are dictated by formula, basically population. So if you have 100 people and you only count 90 people, because you're not going to count people that, you know, the immigrants, as you mentioned, let's say the 20% If you have 100 people, don't count 20% of them, then what's going to happen is you get funding only for 80 of them, but the needs are for 100 people. And this is why, you got to, hand it to the president. He doesn't give up. He's wrong, but he doesn't give up, and we need to fight him. First, he went to the Supreme Court about the citizenship question. Then after that, he put out that memo. That memo, the court's already said that he's wrong because he's trying to stop immigrants from being counted. And that would mean less money for the Valley and certainly for the state of Texas, less members of Congress.
Thank you.
Go ahead, Congressman.
If you will, I could reiterate everything that Henry just talked about, but I'll also say that when you don't count foreign nationals that are in our communities, it hurts and it impacts American citizens, whether it's education, healthcare, infrastructure, just all the resources that we get that are federally funded by the count we have every 10 years through the census. And for an approximation of every 1,000 homes that go undercounted, we lose about $150 million over the decade. So the most likely groups to go undercounted are those immigrant communities, people that live in rural areas, people that live in the colonias or places that are hard to reach out to. Those are the likely places where the undercounts occur. And it's very easy to have 5,000 or 10,000 households within that community. If you're talking in the Rio Grande Valley with 1.3 million approximate people, we have about 250,000 immigrants. If those folks, even just half of them or a third of them do not get counted, it is a $1 billion impact over the decade for our region and for our area. And that impacts American citizens. If we don't have the healthcare resources that we deserve by the numbers that we have, it impacts healthcare, because when those immigrants have to go to the ER because they're suffering by the pandemic, people aren't questioning at the ER if they're US citizens or not. They're coming in. And if there's an overload, like the one I was talking about a few minutes ago, Americans are dying in ambulances outside of the ER. That's just one example. Also, and when it comes to education, when it comes to infrastructure, we need to know how many people are on the roads. We need to know what our colleges and universities need. When we get, hopefully, we finally get the vaccine we need. We need to make sure that the numbers of vaccines that our communities get are the appropriate numbers. And clearly, obviously, the representation that we get in Austin and in Washington relies on those numbers. So as Congressman Cuellar just mentioned, that nowhere in the Constitution does it say you must be United States citizens. We need to know how many human bodies live in a region to be able to properly calculate the federal resources that need to be allocated there. And that's the importance, that's the real importance of being counted and the reason for it and the historical reason for it. So I can't say more. We need to count everyone. We need to make sure that we are aggressive on this outreach. Latino communities, as you know, we've fallen behind. We're under the state average, and we're clearly under the federal average in getting counted. So we've been doing a big push. I encourage everyone here who's listening to do this in your communities, because at the end of the day, these are federal dollars that come to our communities by counting everyone. And at the end of the day, it could mean your life, it can mean your health, it can mean your kids' education, better roads, bridges, and infrastructure that can also save lives by having the best. And we need to be counted. And I feel that, especially our communities, the state did not invest in the appropriate outreach for the census. So we have to take it upon ourselves, counties and cities and precincts, to really go out and communicate this message that everyone must be counted, that there should be no fear in being counted, and that at the end of the day, it means dollars and cents that can give you a better lifestyle, but can ultimately save your life. And that's just a fact. Thank you.
Thank you,
Thank you, Congressman. We're going to pass this back to Rebecca now to read the next question.
We've gotten a question in Spanish. Hemos recibido una pregunta en español. Si alguien la puede contestar en español. La primera parte de esa pregunta, the first part of that question is, si ha funcionado la estrategia del gobierno federal para contener el COVID-19. So in Spanish, please, has the federal response on COVID-19, has that worked? And then the second part of that question is, ¿por qué no abrir los cruces terrestres con México para los de visas fronterizas? So that will probably be for one of the members of Congress, is why have we not opened up the border crossings by land? Si alguien la quiere tomar esa pregunta en español, ¿ha funcionado la estrategia del gobierno federal para contener el COVID-19?
I'll be happy to take it. Or you can go, Henry.
Go ahead. No, you go first.
Pues es muy claro que no ha funcionado la estrategia nacional porque vamos atrasados de muchos países primermundistas. No tuvimos los recursos necesarios en muchos lugares y todavía tenemos cifras muy altas de mortalidades, de gente en hospitales y de infecciones, y todavía no tenemos un plan nacional para hacer exámenes eficientes y saber quién está infectado temprano y poderles darle el cuidado que necesitan para salvarles la vida. En el tema del puente, todos queremos abrir los puentes porque nos impacta nuestra economía en el sur del estado, pero necesitamos que tener mucho cuidado y estar conscientes que en México está sucediendo un problema muy grave y que hay muchas infecciones y los números que nos dan no son muy confiables. Necesitamos que estar seguros que antes de que abramos las fronteras, que podamos tener una comunidad segura, que nuestra gente que vive de este lado de la frontera no vaya a tener mayores infecciones y cause más problemas más allá. Así es que yo quiero abrir las fronteras, quiero que empiece el turismo, que nos levante la economía, pero lo tenemos que hacer de una manera segura y sana y que no nos cueste vidas en nuestra región. Thank you.
Sí, bueno, la primera parte de la pregunta, no, el presidente Trump no tiene plan para pelear COVID-19. Primero, él tomó la posición que no hay problemas con el COVID-19, que no había riesgos, y sabemos que estaba diciendo una cosa en privado, pero en público está diciendo otra cosa. Y por eso estamos teniendo como un país un gran problema con el COVID-19, porque el presidente primero ha tomado una posición de no tomar los riesgos en el cuento y no tiene el plan para atacar esto. La segunda parte de la pregunta es sobre cómo vamos a abrir el negocio. Mira, ahorita las restricciones que tenemos en la frontera que puso el presidente Trump dice, si eres esencial, por ejemplo, en comercio puedes entrar. Pero si no eres esencial, por ejemplo, las personas que vienen a compras, a los hoteles, a los restaurantes, a las tiendas, no pueden cruzar ahorita. El problema es que el presidente no entiende la frontera. Muy francamente no lo entiende. Porque las personas que dicen que no son esenciales ahorita, nosotros en la frontera, como Vicente o yo o Mike, las otras personas, Rebeca, sabemos que esas personas son muy importantes porque hay tiendas que dependen en 50-75% de las compras de los mexicanos. Y ustedes saben que octubre, noviembre y diciembre son los meses más importantes para esos negocios en la frontera. Yo lo presenté hace como 2 meses al secretario de Homeland un plan cómo podemos cómo podemos abrir. Es algo muy simple. En unos aeropuertos se hace el Enhanced Medical Screening, una manera para ver las personas que vienen, se van a dar una rapid test, se van a dar un examen. Si eres un mexicano y si sales negativo, entras y puedes comprar. Si eres un mexicano que sale positivo, con muchas disculpas, te vas a regresar. Si eres un americano, la misma cosa, entras, pero te ponemos en cuarentena. Es que hay un plan que ya se lo presentamos al Homeland Security, el secretario, pero estamos esperando. El problema es muy simplemente porque me dijeron que esto se mandó a la Casa Blanca. Y usted sabe cómo trata el presidente a México. Y en mi opinión, la semana que viene, ya pronto, van a necesitar que hacer una decisión porque se acaban las restricciones el primero, que es el 21 de septiembre, es que van a hacer una decisión ya rápido. Yo creo que ellos no están viendo un plan para abrir la frontera. Lo podemos hacer, la seguridad de la persona y la seguridad de nuestra economía.
Thank you, Cuellar. I know there are a lot of questions here, but we only have time for a couple more. The next one is for Rebecca and Congressman Cuellar. It's from Jeremy Walls of the Houston Chronicle. In most of the state, Democrats saw an increase in votes in 2018 compared to 2016. But in Webb County and much of the Valley, it was lower. Beto O'Rourke underperformed Hillary Clinton. What are you guys doing to change that?
I'll let Rebecca now follow up.
Absolutely. We have organizers in our organizing director is from and lives in Mission, Texas. We have organizers in Webb County. We are having dozens of events every single day. They're visible on our Mobilize page. We'll send it around to the press, where we are talking to voters, hundreds of thousands of voters every day. We're specifically focusing on South Texas and border communities, as you can see on our phone banks. We also have standing weekly events targeting Latino voters and standing weekly Spanish language events. We have great surrogates. We have a wonderful surrogate tonight for our Latino Millennials event. So we are engaging this community because the staff is this community. We're having dozens of phone banks every single day. Some are border targeted, some are Spanish targeted, and you'll be seeing more digital ads from us targeting Latinos.
Let me give you a general, and then I'll go down to South Texas. First of all, if you look at the state of Texas and look where Democrats win and where Republicans win, you will see Democrats usually do well along the urban areas, Houston, Dallas, San Antonio, Austin, etc., and along the border. The firewall that the Republicans have right now is called rural Texas, the rural part. One of the things that Beto did well was, there's two things to win those rural areas. One, you got to show up. And two, you got to be able to talk to the folks and see what's important to the folks in the rural areas. Beto O'Rourke did very well on the first part. That is, he showed up. By showing up, he won some of the rural areas. And in some of the areas that he lost, instead of losing at 75-25, he lost it by a smaller amount. So showing up is one thing. So that's one thing in the rural areas, showing up and making sure we speak. Now, along the border areas, Webb County, South Texas, the key is going to be the Hispanics. And the key is the repetitive, going out and making sure that we touch them and we go out and get them out to vote. And that's possible. And this is something that we're hoping through Rebecca's leadership, the Texas Democratic Party, we can get the Latinos. So if we're able to get the Latinos up just by a small amount, every county, and then look at the rural areas, Texas would certainly turn blue.
Great. Thank you, Congressman Cuellar. We have time for one more question here. It comes from Maria Mendez of Texas Public Radio. Prior to the pandemic, one of the biggest election issues for South Texas was the border wall. Why is the border wall still bad policy, and how has the pandemic overshadowed that issue? And we can go to anyone who wants to answer this. Congressman Cuellar, we can start with you.
Yeah, I'll go on. Look, the wall is a 14th century solution to a 21st century problem. What you got to look at, it was interesting. I thought during this pandemic that everything was going to slow down. But if you notice, one of the things that President Trump did, he actually accelerated the building of the fence or the wall itself. What's interesting is they've already obligated millions, hundreds of millions of dollars for contracts to build this fence without even owning the property. So when you look at it, they're trying to meet this campaign promise. When you hear the president talking about 300 miles of new fencing, that's actually not very accurate. It includes double fencing. That is, there was a fence and they had another fence. That means that they had an existing fence and they put another fence. Actually, new miles of fencing is 5 new miles of new fencing where no fence existed in the past. But he's trying to push this narrative that he's going to build this fence itself. What we need on the border is personnel and technology. And if we're able to do that, we'll be able to secure the border. And this, I'll close up with this, because they think people what the administration says, you're against a wall, you're against border security. That is false. We believe, Vicente and myself, we believe in border security, but we believe in smart border security. That is having the personnel at the border, making sure that we also have the technology. And by the way, when the president talks about stopping drugs in people, let's look at a couple of things. Most drugs, for example, you take fentanyl. 92% of the fentanyl come into the United States through ports of entry. So even if you put a fence, 92% of that will come through a port of entry. And that's the same thing with other drugs. And then when he says he wants to stop people from coming in, put a fence so you can stop people, 62% of the people that are here without papers came in through a visa overstay. That is a student visa, a work visa, and they overstayed. And by the way, did you know that the number one violator of this visa overstay is Canada? Canada. I was on the floor arguing against the wall, and I told my Republican friends, and when I told them that, I said, I dare one of you, or even the president, to say that they should put a wall with Canada. They wouldn't do that, but they sure don't believe in private property rights. They sure don't believe in the environment. They sure don't believe in the culture that we have in South Texas, and that's why we're against the wall.
Great. Anybody else want to take that?
Well, I'd be happy to join. You know, and as Congressman Cuellar said, we're for border security, but we're for smart border security, not a wall at a $25 billion monumental price of taxpayer dollars. We have cutting edge technology that we're using now, that exists, that we're using to protect borders around the world. And
I think we lost Congressman Gonzalez. It's actually perfect timing, though. That is all the time we have for questions. I know that there are a lot more questions that we have here. If you want to ask these questions to the individual speakers, email me at abhi@txdemocrats.org. Again, that's abhi@txdemocrats.org, and we will get those questions over to the speakers that you want to talk to. With that being said, Rebecca, do you want to close this out?
Muchas gracias a todos por venir a este día a hablar de la importancia del voto latino del sur de Texas y de nuestras comunidades. Thank you all for coming to join us today to talk about the importance of South Texas, the Latino vote. We know that our community is more affected than anyone else. We do hear that every election is the most important election. Our lives are literally at stake this year. South Texas, we can change the state and change this country. We can surprise everyone. We can make shockwaves. We can say that it was our vote, it was our power that helped to send our 38 electoral votes to Joe Biden, Kamala Harris, and elect Democrats up and down the ballot. We are fighting for our communities, and we will continue to do so every day. Thank you.
Thank you, guys. Hope you all have a great rest of your afternoon.